Right, based upon projections that death tolls in the U.S. could exceed 100,000 people, President Trump announced yesterday that he will extend the restrictive social distancing guidelines through the month of April. Now, this includes a cap of 10 people on meetings. Now, will the continuation of these limits save lives? Joining me now is Dr. Marty Makary, a Johns Hopkins health policy expert and surgeon. Doctor, welcome back to Washington Watch.
Good to be with you, Tony.
All right, based on what the president said yesterday with the data coming in and now projections from his task force saying that we could see death tolls from the coronavirus exceed 100,000, is he taking the right steps?
I think so. You know, we want our leaders to be optimists, and we want them to give us spirit and hope. But the reality is they are all closely following these numbers, not only in the preview that we're seeing in some countries overseas like Spain, but also locally in New York City. And it's pretty clear to everybody that we'd rather be in a position where we look back and say, you know, we were over-prepared and it wasn't quite as bad as we thought, than to actually have avoidable deaths. And right now, unfortunately, looks like we are on track to have our hospitals overburdened and to maybe see some avoidable deaths. That's what we really want to address.
So the problem is really the overwhelming of the healthcare system at one time, how rapidly this curve goes up. And so we have the inability to care for people. That's the biggest crisis that's presently developing, is it not?
Absolutely. It's all about rationing and our limited resources at the peak of this epidemic. So, you know, folks may be going outside right now saying it's a beautiful day. There's, you know, my kids are in my backyard playing. What's the big deal? I don't know anyone who's dying that I'm friends with. What's the big deal? And the reality is we are gearing up for a tsunami that's going to hit with a massive impact on that peak. Now, until then, it'll be a slow symmetric incline, and on the decline, it'll be about equal to what we see in the rise up. But we've got to ahead of time plan and manage that peak, because when that peak happens, talk to any doctor or nurse right now, it's going to be ugly. We are basically at full capacity in some U.S. hospitals with very little room to take care of people that come in from this point forward.
Now, as of this morning, we had 140,000 cases and more than 2,500 deaths. Now, the task force, in their recommendations, have projected that we could see upwards. Their models show up to 200,000 deaths in the United States. Is that realistic?
Yeah, it is, Tony. Last weekend, I went on Fox News Sunday and basically suggested that we are on track right now to have hundreds of thousands of deaths and millions more cases. So I think we need to plan on that. Now, I'll tell you, even as somebody who's from Johns Hopkins, and I don't speak for the institution, but the map is a good map, and people follow the numbers, but I don't pay attention to the number of cases diagnosed. We know there was massive underreporting from some countries.
Right.
We know that the number of diagnoses is proportional to testing. I follow the antibody positivity rate, the number who are immune, whether or not China has reopened schools, the number of deaths per day coming out of Spain right now, the response time for 911 calls in New York City, the ventilator production rate per day right now in the United States. Those are the metrics that I follow closely.
So your projection based upon where this peaks, are we 2 weeks away, 3 weeks away? Where are we from that point?
New York is about 2 weeks away. The rest of the United States is probably 3 to 5 weeks away, depending on where you live. Now, one of the big concerns that many of us have is that some parts of the country were sort of slow to recognize that this is a real threat. Some places immediately took dramatic steps, and others, there was sort of life as usual pretty late, even up until recently. And our fear is that those places that have taken the least precautions may get hit the hardest. It's balanced by the fact that some cities have more public transit and some cities are more congested. But our concern is the cities that have been in denial, if you will, may get hit even harder because this infection is seeded everywhere in the United States. We need to abandon the idea that it's somehow contained.
So, Dr. Makary, your recommendation to people when it comes to the guidance from the CDC, from the White House, and then from state officials, your recommendations when it comes to that guidance?
Take it seriously, and take it seriously for the sake of our most vulnerable. The reality is it is hard for this virus to really hurt young, healthy people, like children. But remember, 20% of the cases are in people of the hospitalizations in particular are in people aged 20 to 44. So you can still get sick and very sick, but it's those at higher risk, the older and those with conditions that are far more likely to die from it. And we've got to behave to manage the influx, to protect them. And our number one risk group, the number one profession who is most likely to get this infection is healthcare workers. What you do in your day-to-day life will actually impact the health of healthcare workers you've never met.
Very good point. Dr. Makary, thanks so much for taking time out today to join us.
Thanks for having me, Tony.
All right, Dr. Marty Makary, Johns Hopkins. It's reality. It's sobering, but it's reality, and we need to do our part. Adhere to the guidelines. Don't be going out like this is a vacation. Be praying. As more and more governors are calling upon their citizens to pray. We need to be praying that God would intervene.